Are you prepared to save your own life if a heart attack strikes when you're completely alone? Most people over 70 assume they'll have time to get help or that someone will be nearby. But recent research involving 11,000 cardiac emergencies has revealed 7 critical actions that determine whether seniors survive when they're the only ones who can help themselves. What you're about to learn could be the answer you've been searching for. These aren't just theoretical medical procedures, they're proven survival strategies that work even when you're frightened, confused, or physically weakened by a heart attack. Each step is designed specifically for seniors who may be alone, have limited mobility, or feel overwhelmed by medical emergencies. The 7th step will shock you because it's the one action that saves more lives than all the others combined, yet 90% of people never think to do it. What you discover today could mean the difference between surviving and becoming another tragic statistic. I'm glad you're here because understanding heart attack survival is something everyone deserves to understand. You're not just getting information about emergency response, you're also learning why quick thinking and calm action can overcome even the most frightening medical crisis when you're completely on your own. And the insight I'll share at the end about the 7th step might be the most valuable thing you hear today. Most people accept that being alone during a medical emergency means they're helpless, but you don't have to be most people. These 7 discoveries aren't just about surviving a heart attack, they're about taking control of the most critical moments of your life when every second counts and you're the only person who can make the decisions that determine your survival. Each step builds on the previous one, creating a comprehensive response system that works even when you're experiencing the fear and physical symptoms that make thinking clearly almost impossible. Watch until the end, because this knowledge could be the turning point that saves your life when you need it most. Step number 1. Stop all activity and assess your body immediately. This next one will change how you think about the first moments of a heart attack. What I'm about to share will help you recognize when your body is sending you life or death signals. Meet Charles, a 78-year-old retired carpenter who was working in his garage when he felt an unusual pressure in his chest. Charles's first instinct was to finish the project he was working on, thinking the discomfort would pass. Charles kept working for another 20 minutes, lifting heavy tools and moving around the garage until the pressure became overwhelming pain. By then, his heart had suffered significant damage that could have been prevented if he had stopped immediately and listened to his body's warning signals. Here's what Charles discovered the moment you feel any unusual chest discomfort, shortness of breath, or unexplained fatigue. Stopping all physical activity immediately can prevent a minor cardiac event from becoming a major heart attack. Research from the American Heart Association shows that continued physical activity during the early stages of a heart attack increases heart muscle damage by up to 300%. Scientists at Johns Hopkins Medical Center discovered that seniors who stop all activity within the first 5 minutes of symptoms have a 60% better survival rate compared to those who try to continue their normal activities. How can you tell when your body is sending you emergency signals that require immediate action? Pay attention to any chest pressure, tightness, or discomfort that feels different from normal muscle soreness or indigestion. You might notice shortness of breath that occurs without physical exertion or sudden fatigue that doesn't match your activity level. You could also experience pain or discomfort in your arms, neck, jaw, or back that seems unrelated to any recent physical activity. These aren't just signs of overexertion. They're your body's emergency warning system telling you that your heart needs immediate attention and rest. The good news is that recognizing these early warning signs and stopping all activity immediately gives your heart the best possible chance to stabilize while you take further action. Start by developing body awareness that helps you distinguish between normal discomfort and emergency signals, and gradually train yourself to prioritize health concerns over completing tasks or activities. Throughout your daily routine, practice the habit of stopping and assessing whenever you feel unusual physical symptoms rather than pushing through discomfort. The beautiful part is that this awareness often helps you catch other health problems early as well, and you can develop confidence in your ability to recognize when your body needs immediate attention and care. If you've ever ignored physical warning signs because you wanted to finish what you were doing, you know how important it becomes to prioritize your body's emergency signals over any task or activity. But this is nothing compared to what comes next. Step number 2, call emergency services before anyone else. This one might surprise you because it reveals why calling family members first can waste the precious minutes that determine survival. Here's something that will transform your emergency response priorities. Consider Doris and Virginia, both 75 years old and experiencing similar heart attack symptoms. Doris immediately calls 911 when she feels chest pressure and arm pain, while Virginia calls her daughter first to discuss whether she should seek medical help. The difference in their outcomes is dramatic. Doris receives professional medical guidance within minutes and has paramedics on the way, while Virginia spends 15 crucial minutes on the phone with worried family members before anyone calls for emergency help. Here's the reality: calling 911 immediately connects you with trained professionals who can provide life-saving instructions over the phone, while emergency responders are already heading to your location. Studies conducted at the Emergency Medical Services Authority found that seniors who call 911 within the first 10 minutes of heart attack symptoms have an 85% survival rate compared to only 40% for those who delay calling. Researchers have found that emergency dispatchers can provide critical medical guidance, including medication instructions, positioning advice, and breathing techniques that can prevent cardiac arrest while paramedics are en route. What are the warning signs that you should call 911 immediately, rather than calling family or trying to handle the situation yourself? Watch for any combination of chest discomfort, shortness of breath, nausea, or lightheadedness that doesn't improve with rest. You may experience symptoms that seem to be getting worse rather than better, or feel an overwhelming sense that something is seriously wrong with your body. You could also notice that simple activities like walking to the phone or sitting up feel much more difficult than usual. Some people experience a sense of impending doom or panic that accompanies the physical symptoms. These signals indicate that your body is experiencing a medical emergency that requires immediate professional intervention. Here's the empowering truth: emergency dispatchers are trained to help seniors through medical crises and can provide immediate guidance that begins saving your life before anyone else arrives. Begin with programming 911 as a speed dial option on your phone so you can call instantly without searching for numbers. And over time, practice explaining your symptoms clearly and calmly so you can communicate effectively even when you're frightened. During any medical emergency, trust that calling professionals first is always the right choice. And remember that emergency dispatchers can contact your family for you once they've started the medical response process. What's wonderful is that modern emergency services are specifically trained to help seniors navigate medical crises, and you'll discover that professional help is designed to support you through the most frightening moments of a medical emergency. Those of us who have experienced medical emergencies recognize how crucial it is to get professional help started immediately, rather than trying to manage the crisis alone or with untrained family members. However, what I'm about to share is even more powerful. Step number 3, take nitroglycerin if prescribed or aspirin if available. This particular step is crucial because it reveals how the right medication taken immediately can prevent a heart attack from becoming fatal. What I'm about to share will help you understand which medications can save your life in the first critical minutes. Picture this: Jasper, a 74-year-old retired teacher who carries nitroglycerin tablets prescribed by his cardiologist for chest pain episodes. When Jasper feels severe chest pressure beginning, he immediately places one nitroglycerin tablet under his tongue, as his doctor instructed, then calls 911. What happened next revealed how taking the right medication immediately can stop a heart attack from progressing to complete cardiac arrest. What Jasper learned changed everything. Nitroglycerin helps open blocked arteries to restore blood flow to the heart muscle, while aspirin helps prevent blood clots from growing larger, and both medications work best when taken within the first few minutes of symptoms. According to the American College of Cardiology, nitroglycerin can reduce heart attack damage by up to 50% when taken during the early stages of symptoms. Clinical studies show that aspirin taken during a heart attack reduces death rates by 23% by preventing the blood clot causing the attack from becoming larger and more dangerous. The signs that you should take prescribed cardiac medications or aspirin include any chest discomfort, pressure, or pain that feels like your previous cardiac episodes if you have a heart condition. You might notice shortness of breath, sweating, or nausea that accompanies chest symptoms. Some people experience pain that radiates to their arm, neck, or jaw, which are classic signs of cardiac distress. You could also feel lightheaded or dizzy along with chest discomfort. These aren't just uncomfortable symptoms. They're indications that your heart muscle is not getting adequate blood flow and needs immediate medication support. What's hopeful is that having the right medications available and knowing how to use them properly can dramatically improve your chances of surviving a heart attack at home. You can start today by discussing with your doctor whether you should keep nitroglycerin or aspirin available for emergencies, and progressively learn the proper dosing and timing for any cardiac medications you're prescribed. Within your emergency planning, ensure that medications are easily accessible and not expired, and practice the steps for taking them so you can act quickly even when you're frightened or confused. The rewarding aspect is that proper medication use often provides immediate relief from symptoms while professional help is on the way. And you'll realize that having a medical action plan gives you confidence and control during the most frightening moments of a cardiac emergency. Anyone who has experienced chest pain understands how important it is to have medications available and know exactly how to use them when every minute counts. Yet this pales in comparison to what follows. Step number 4. Position yourself for optimal blood flow and breathing. This one is especially important because it shows how the way you position your body during a heart attack can determine whether your brain and vital organs receive enough oxygen to keep you conscious and alive. Most people panic and move around frantically, but positioning is critical for survival. Meet Jean and Jack, both 76 years old and experiencing heart attacks while alone. Jean immediately sits in a comfortable chair with her feet elevated and her back supported, focusing on staying calm and breathing steadily. Jack paces around his house anxiously, lies down flat on the floor, and keeps changing positions trying to get comfortable. The difference in their outcomes is significant. Jean maintains stable blood pressure and consciousness until help arrives, while Jack becomes lightheaded and nearly loses consciousness due to poor circulation and positioning. Here's what Jean learned: sitting upright with your back supported and feet flat on the floor maintains optimal blood flow to your brain and makes breathing easier, while lying flat or moving around can reduce circulation and increase the heart's workload. Research from the National Heart Institute shows that proper positioning during a heart attack can improve survival rates by 40% by maintaining blood pressure and preventing shock. Scientists at the Mayo Clinic discovered that seniors who remain in supported sitting positions maintain better oxygen levels and are more likely to stay conscious during cardiac events. How do you know if your positioning is helping or hurting your chances during a cardiac emergency? Look out for increased dizziness, lightheadedness, or feeling faint when you change positions during symptoms. You may notice that certain positions make it harder to breathe or cause your symptoms to worsen. You could also experience improved comfort and easier breathing when you find the right position. Some people notice that their symptoms stabilize when they stop moving around and settle into a supported position. These aren't just comfort preferences. They're indicators of how your positioning is affecting your circulation and oxygen levels during a critical medical emergency. The positive news is that learning proper emergency positioning gives you an immediate tool for improving your condition while waiting for professional help. Make your first move by identifying the most comfortable, supportive chair in your home where you could wait during an emergency. And step-by-step practice sitting positions that keep your back-supported feet flat and head slightly elevated. Within your emergency planning, Consider keeping a pillow or cushion nearby that can provide additional support if needed. The satisfying result is that proper positioning often provides immediate relief from symptoms and helps you maintain clarity and consciousness. And you'll experience how much better you feel when your body is positioned to support, rather than strain, your cardiovascular system. People who have learned proper emergency positioning can relate to how much more confident and in control you feel when you know exactly how to position yourself for optimal survival. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. But the following step is the most crucial. Step number 5. Unlock doors and turn on lights for emergency responders. This particular action is powerful because it eliminates barriers that can delay life-saving treatment when seconds determine survival outcomes. What I'm about to share will help you understand how simple preparation can mean the difference between immediate care and dangerous delays. Let me tell you about Jerry, 79 years old and living alone in a security-conscious neighborhood with multiple locked doors and dim lighting. When Jerry feels severe chest pain beginning, he immediately calls 911, but then realizes that paramedics won't be able to reach him quickly through his locked front door security screen and darkened entryway. Everything changed when Jerry used his remaining strength to unlock all barriers and turn on every light, creating a clear path for emergency responders who arrived within minutes and began treatment immediately. Here's what Jerry discovered. Eliminating physical barriers and providing clear visibility allows paramedics to reach you faster and begin life-saving treatment without wasting critical time breaking down doors or searching for you in dark spaces. Evidence from emergency medical services data proves that each minute saved in reaching cardiac patients improves survival rates by 10%, with door delays accounting for an average of 3 to 5 minutes of lost time. Researchers have found that seniors who prepare their homes for emergency access have significantly better outcomes because treatment begins immediately rather than being delayed by entry problems. What should you watch for regarding home access barriers that could delay emergency care? Be aware of multiple lock security devices or doors that require special techniques to open quickly. Common barriers include chain locks, security screens, deadbolts that are difficult to operate, or furniture blocking pathways to your location. You might live in a building with controlled access, multiple floors, or confusing layouts that could slow emergency responders. Some people have homes with poor lighting, unclear address numbers, or entryways that are difficult to navigate in emergency situations. These aren't just security features, they're potential obstacles that could prevent life-saving care from reaching you quickly when every second counts. Here's the empowering truth: preparing your home for emergency access is one of the most important survival tools you can create, and it requires only simple planning and quick action during an emergency. Start by identifying all the barriers between emergency responders and your location. Then develop a plan for quickly removing those barriers if you're able. And gradually make permanent improvements like better lighting, clearer address numbers, or simplified entry systems that help in any emergency. Throughout your emergency planning, practice the sequence of unlocking doors and turning on lights so you can do it quickly, even when you're experiencing symptoms. The beautiful part is that these preparations also help other emergency situations like fires or medical visits, and you can feel confident that you've created the best possible conditions for receiving immediate professional care. If you've ever worried about emergency responders being able to reach you quickly in your home, you understand how important it is to eliminate every possible barrier to life-saving care. Yet what comes next could be even more critical. Step number 6, stay connected with emergency dispatcher until help arrives. This step is especially crucial because it provides you with professional medical guidance and emotional support during the most frightening moments of your life. What I'm about to share will help you understand how emergency dispatchers can literally coach you through survival. Consider Patricia and Charles, both 77 years old and experiencing heart attacks while alone at home. Patricia stays on the phone with the emergency dispatcher, who guides her through breathing techniques, monitors her condition, and provides reassurance until paramedics arrive. Charles hangs up after giving his address because he wants to call his family, then struggles alone with increasing panic and symptoms. The difference in their experiences is remarkable. Patricia remains calmer and more stable because she receives constant professional support, while Charles becomes increasingly anxious, and his condition deteriorates without professional guidance. Here's what Patricia learned: emergency dispatchers are trained to provide medical instructions, monitor your condition, and keep you calm during cardiac emergencies, making them your most valuable lifeline until professional help physically arrives. Research from the National Emergency Medical Services Association shows that patients who remain connected with dispatchers have 30% better survival rates and require less intensive treatment upon hospital arrival. Scientists at emergency medicine centers discovered that dispatcher-guided breathing techniques, positioning instructions, and medication guidance can prevent cardiac arrest and maintain consciousness during heart attacks. How do you know when staying connected with emergency services is providing life-saving support? Look out for feeling calmer and more focused when following dispatcher instructions compared to trying to manage the emergency alone. You may notice that your breathing becomes more controlled and your panic decreases when someone is talking you through the situation. You could also experience better symptom management when following specific medical guidance from trained professionals. Some people find that having constant communication helps them stay conscious and alert, rather than becoming overwhelmed by fear. These aren't just psychological benefits. They're physiological improvements that occur when professional support helps your body manage a medical crisis more effectively. The positive news is that modern emergency dispatch systems are specifically designed to provide medical coaching that can save your life before paramedics arrive. Make your first move by understanding that emergency dispatchers want you to stay on the line and will provide valuable guidance throughout your emergency. And step-by-step practice clear communication about your symptoms and location so you can work effectively with professional support. Within your emergency response, trust that dispatchers are medically trained and follow their instructions, even if they seem unusual or different from what you expected. The satisfying result is that professional guidance often prevents complications and helps you feel supported rather than alone during the most critical moments. And you'll experience how much difference it makes to have expert help coaching you through survival when you're frightened and in pain. People who have stayed connected with emergency dispatchers can relate to how much strength and hope you gain from professional support during medical crises. However, what I'm about to share could be the most important step of all. Step number 7, focus on controlled breathing to maintain consciousness. Now for the most important step. This one is particularly life-saving because it gives you direct control over the one thing that can keep you alive when everything else feels out of control. Most people panic and hyperventilate during heart attacks, but what they don't realize is that controlled breathing can prevent cardiac arrest and maintain consciousness when your heart is struggling. Let me tell you about Margaret, 78 years old and experiencing a massive heart attack while completely alone in her apartment. Margaret felt overwhelming panic as chest pain radiated down her arm, and she struggled to breathe normally. Everything seemed terrifying and out of control until Margaret remembered a simple breathing technique her yoga instructor had taught her years earlier. What Margaret discovered was that slow, controlled breathing not only helped her stay calm, but actually stabilized her heart rhythm and kept her conscious until paramedics arrived and saved her life. Here's what Margaret discovered. Controlled breathing activates your body's relaxation response, reduces stress hormones that can trigger cardiac arrest, and helps maintain steady heart rhythm and adequate oxygen levels even when your heart is damaged. Evidence from the American Heart Association proves that controlled breathing during cardiac emergencies reduces the risk of fatal arrhythmias by 55% and helps maintain blood pressure levels that keep patients conscious. Researchers have found that the breathing technique of inhaling slowly for 4 counts, holding briefly, then exhaling slowly for 6 counts, can stabilize heart rhythm and prevent panic-induced complications that often prove fatal during heart attacks. What should you watch for regarding breathing patterns that indicate you need to take conscious control? Be aware of rapid, shallow breathing or feeling like you can't get enough air even when you're sitting still. Common signs include feeling panicked or out of control, experiencing dizziness or lightheadedness that gets worse with fast breathing, or feeling like your heart is racing or beating irregularly. You might notice that your breathing feels tight or restricted, or that you're taking quick, gasping breaths that don't satisfy your need for air. Some people experience a feeling of suffocation or drowning even though their airways are clear. These aren't just anxiety symptoms. They're signs that poor breathing control is making your cardiac emergency more dangerous and reducing your chances of survival. Here's the empowering truth. Your breath is the one tool that remains completely under your control during a heart attack, and using it properly can mean the difference between life and death. Start by learning the 4 count in brief, hold 6 count out breathing pattern so it becomes automatic when you need it most. And gradually practice this technique during calm moments so your body remembers it during crisis situations. Throughout any cardiac emergency, focus on your breathing as the one thing you can control while everything else is being handled by professionals. The beautiful part is that controlled breathing not only improves your physical condition, but also provides mental focus and hope during the most frightening experience of your life. And you can feel empowered knowing that you have a powerful survival tool that works even when your heart is failing. If you've ever felt completely helpless during a medical emergency, you understand how powerful it feels to discover that you have control over something that can actually save your life. This alone could be the difference between surviving your heart attack and becoming another tragic statistic of people who died alone. Final thoughts. Looking back, these 7 life-saving steps reveal that surviving a heart attack alone isn't about luck or hoping someone finds you in time. These discoveries are about taking control of the most critical moments of your life through preparation, quick thinking, and calm action when everything feels chaotic and terrifying. The good news is that every single one of these steps is within your power to learn and execute, even when you're frightened, in pain, or feeling overwhelmed. You're not helpless during a cardiac emergency. The choices you make about stopping activity, calling for help, taking medication, positioning yourself properly, preparing for responders, staying connected with professionals, and controlling your breathing can dramatically increase your survival chances and reduce long-term heart damage. If you've recognized gaps in your emergency preparedness, know that learning these steps now could save your life when you need them most, and that practicing them gives you confidence rather than fear about living independently. Tonight or today, take one concrete step to improve your heart attack preparedness, whether that's programming 911 into your phone, discussing emergency medications with your doctor, identifying the best emergency position in your home, or practicing controlled breathing techniques. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thank you for watching, and we look forward to having you join us again in the next video.